Hey, today we're gonna do the postpartum vaginal assessment. First, we're gonna identify our patient. We're gonna ask the patient to state her name and date of birth. Then we're gonna introduce ourselves and explain the procedures we're about to do. And also, we're gonna define her level of pain if the patient is in really bad pain. She's really sensitive, we can't even touch her, or she can't even move her feet, then we need to get a pain reliever prescribed by the doctor. And also after that, we're gonna provide privacy for our patient. We're gonna make sure her body is empty before we start the assessment, and we're gonna start by assessing the fundus. We want the fundus to be firm and also at the midline, and also the fundus height goes 1 finger breadth per day. Okay, and if we see any bagginess, if we feel bagginess at the fundus, we need to report that also. And now we're gonna assess the vagina. Vaginal walls are supposed to be thin and dry, but we need to have in mind that the uterine lining is cast, the necrotic tissues, blood, and mucus leave the body through the vagina. So it's most common to see edema and bruising at the perineum. Okay, now we're gonna assess for lochia. There are 3 types of colors. It is depending on which time is the patient. And the first and second day after delivery, we're gonna see the lochia rubra, which is bright red color. And we're gonna see a little bit of clot too. We're gonna see little clots, not big clots. And the following days, we're gonna see lochia serosa, which is more thinner and is pink to brown color. And after the 7th day, we're gonna see lochia alba, which is yellow to white color, and you're gonna see the drainage to continue for the rest of the 7 days to 2 weeks. And something we need to know at this time, if we are looking at lochial bleeding or we are looking at non-lochial bleeding. So we need to know the difference between those. And at the lochial bleeding, it's usually trickles. So you're gonna see a trickles coming out from the vagina. Also, the steady flow will be greater as the urine contract. So every time the uterus contract, you're gonna see lochia coming out. And also we're gonna see that the lochial increases if the mother is breastfeeding or she's ambulating. Okay, and on the other hand, we're gonna see the non-lochial bleeding, which is that happens when there's a spurt of bleeding coming out from the vagina, and that means there's a tear in the cervical or the vagina. And if the bleeding is consistency and is excessive and it's red right color, that means there's a tear somewhere in the vagina. So that's the difference between those two. And also we're gonna look at the assess the odor. It's supposed to be a flesh odor lochia, and but if there's a foul odor, we need to report that. That might be infection. And also we need to look at the amount of the lochia, which is looking at the pad. So to determine the amount of the drainage, we're gonna look at the pad. If it's light or moderate or heavy or scant. So the scant, you're gonna see lochia less than 1 inch, and if it's light, you're gonna see less than 2 inches. If it's moderate, we're gonna see less than 6 inches. And also at the heavy, we're gonna see the pad to be saturated within 1 hour. Okay, and also we're gonna make sure we look at the patient, under the patient at the bottom, to make sure the blood is not pulled under the patient, and our patient doesn't have one, and so we're good. And also we're gonna look for signs, symptoms of hypovolemic shock. So if we see excessive bleeding, like the pad is soaked entirely in 15 minutes, that's really excessive bleeding. So that's a sign of hypovolemic shock. And also if the patient say it feels funny, it feels lightheaded, or it's seeing stars, then that's a sign it might have a hypovolemic shock. So we need to report that. And also we're gonna check at the episiotomy. Okay, if there's one present, then we're just gonna put the patient on her side, at her side, not the affected side. And gonna flex her legs toward her waist. Okay, and then what we want to see is the edges well approximated, and also we want to see that is no edema, and we don't want to see any arrhythmia. We don't want to see any drainage. Okay, and also it's gonna take 2 to 3 weeks to heal, and we're assessing for hemorrhoids. Okay, and also we're gonna look at the lacerations of the patient. We need to remember that it has first, second, third, and fourth degree of laceration. It just depends on the degree. It takes the time to heal. So after that, we're gonna make sure the edges again is well approximated and with no drainage on it. And we're gonna our most worriness and danger right now is hemorrhage and infection. So we're gonna go to your patient to keep cleaning front to back. We're gonna use the spray water bottle for after voiding, and also change the pads frequently after voiding, and also when it's soiled, it needs to be changed. And also use the ice pack to lessen the edema at the perineum. And we're gonna, if there's some vaginal discomfort in the patient, we're gonna give her medicines or creams or spray for her, anesthetic cream or spray for her to feel better, just as the physician prescribes. And also we're gonna clean her and leave her a new pad, and ask the patient if she has any concern, any questions about anything at all, or any problems, and leave her in a comfortable position, low, bed low, lock, collar in reach, and at the end we're gonna document our assessment, right? Thank you.